Quiet changes are happening inside your body right now that could be pointing to something important. Small shifts in how you feel, how your body looks, and how you respond to food throughout the day. Most people ignore these signs because they seem minor or unrelated, but when you understand what these signals mean, you start to see a pattern. A pattern that reveals one of the most common yet overlooked health issues affecting millions of people around the world: insulin resistance. Today, you're going to discover the hidden signs that appear long before any doctor mentions a problem. You will learn what they mean, why they matter, and most importantly, how to recognize them in yourself or in someone you care about. This is not about creating worry. This is about giving you the power to see what others miss and to take action early when it matters most. Most people think that health problems announce themselves loudly. They imagine pain, obvious symptoms, or dramatic changes that force immediate attention. But insulin resistance does not work that way. It moves slowly and quietly. It builds over months and years, hidden behind normal routines and everyday feelings. By the time someone realizes there is a problem, the body has already been struggling silently for a very long time. That is why understanding the early clues is so valuable. These signs are not vague. They are specific, measurable, and repeatable. Some show up on your skin, others affect your energy, some change the way your body looks, and many influence how you feel after eating. When you learn to connect these dots, you gain a complete picture of what is happening beneath the surface. Stay with me through this entire video, because the information builds on itself. Each section adds another layer of understanding. By the end, you will know which signs are the most reliable, which combinations are most concerning, and why even healthy-looking people can develop insulin resistance without realizing it. You will also discover facts that challenge common beliefs. For example, many assume this condition only affects people who are overweight or inactive. But research shows that genetics, chronic stress, poor sleep quality, and even certain medications can trigger insulin resistance in people of all body types. Thin individuals can have it, athletes can have it, young people can have it. The body does not always show its struggles on the outside. Another critical detail is the compensation phase. This is the period when your body works overtime to hide the problem. During this time, your pancreas pumps out extra insulin to force glucose into resistant cells. Blood sugar tests may look perfectly normal. You may feel fine most days, but beneath that surface calm, insulin levels are climbing higher and higher. This silent rise creates a cascade of changes. It promotes fat storage, especially around your midsection. It increases hunger and cravings. It disrupts hormones, and it sets the stage for more serious problems down the road. The external signs you will learn about today are the body's way of revealing this hidden battle. Understanding them gives you an advantage that most people never get. You can make changes before the problem grows. You can protect your health while you still have time. If you value learning how your body works and want practical knowledge that can help you live healthier and longer, this channel is for you. We break down complex health topics into clear, useful information that anyone can understand and apply. Subscribe now so you do not miss future videos that can change the way you see your own health. Now, let us begin with the foundation. What exactly is insulin resistance and why does it develop? Insulin resistance is what happens when your body stops listening to insulin the way it should. To understand this, you first need to know what insulin does. Insulin is a hormone made by your pancreas. Think of it as a messenger that carries an important instruction. After you eat, your food breaks down into glucose, which is a type of sugar that your cells use for energy. That glucose enters your bloodstream, and your body needs to move it from the blood into your cells, where it can actually be used. That is where insulin comes in. It acts like a key that unlocks the door to your cells, allowing glucose to enter. When this system works smoothly, your blood sugar stays balanced, your cells get the fuel they need, and your body functions efficiently. But with insulin resistance, the locks on your cells begin to change. The key still fits, but it does not turn as easily. The cells start ignoring the signal they resist. When this happens, glucose cannot enter the cells properly, and it stays in the bloodstream instead. Your body detects this problem immediately. Blood sugar is rising, and cells are not getting energy. So your pancreas responds by making even more insulin. It floods the system with extra insulin, trying to force the resistant cells to open up. In the early stages, this strategy works. The extra insulin manages to push glucose into the cells, and blood sugar stays in the normal range. This is why insulin resistance can exist for years without anyone noticing. The body hides the struggle behind the scenes. However, this is not a sustainable solution. Over time, your cells become even more resistant. Your pancreas has to work harder and harder, producing higher levels of insulin just to maintain normal blood sugar. High insulin becomes a problem all on its own. It sends signals throughout your body that change how you store fat, how hungry you feel, and how your other hormones behave. High insulin tells your body to store energy as fat rather than burn it. It makes weight loss difficult even with exercise and careful eating. It increases cravings, especially for sugary and starchy food. It also affects your cardiovascular system, raising blood pressure and increasing inflammation in your blood vessels. Insulin resistance does not appear overnight. It develops gradually as the result of many factors coming together over time. Carrying excess fat, especially around the belly, is one of the strongest triggers. Belly fat releases chemicals that interfere with insulin signaling. Lack of physical activity also plays a role because muscles are major users of glucose. When muscles are inactive, they become less sensitive to insulin. Chronic stress raises cortisol levels, which can interfere with how cells respond to insulin. Poor sleep disrupts the hormones that regulate hunger and metabolism, making insulin resistance worse, and genetics matter too. Some people are simply more prone to developing this condition based on their family history. Even diets high in processed foods and added sugars can push the body toward resistance over time. All of these factors create a slow drift away from healthy insulin function, and the body leaves clues along the way. One of the main reasons insulin resistance flies under the radar for so long is that it does not hurt. There is no pain, no sudden alarm, no dramatic moment that forces someone to take notice. The body compensates so well in the beginning that daily life continues without interruption. People wake up, go to work, eat meals, and feel mostly normal. Meanwhile, inside, insulin levels are climbing, and cells are struggling to communicate properly. This mismatch between how things feel and what is actually happening creates a dangerous blind spot. Another reason people miss it is that the signs are scattered and vary. One person may notice their waistline expanding, even though their eating habits have not changed much. Another may feel unusually tired after lunch every day. Someone else may develop small skin changes or more frequent sugar cravings. None of these clues seem related on the surface, so they are written off as separate issues. Stress, aging, a busy schedule, people rarely connect them to a single underlying cause. And because these early warnings are mild, they do not trigger concern. They are easy to dismiss. Routine medical checkups often do not reveal the problem either. Standard tests usually measure fasting blood sugar, and that number can remain normal for years while insulin resistance is already developed. Unless a doctor specifically checks fasting insulin levels or orders more detailed metabolic testing, the condition stays hidden. By the time blood sugar finally starts to rise, the body has often been in a state of insulin resistance for a decade or more. That is a long time for silent damage to build. This is why learning to read your body's signals is so important. You can spot the pattern early, long before tests show anything unusual. And that early awareness is what gives you the power to make changes that actually matter. The body often reveals insulin resistance through visible signs that appear on the skin and in the way fat is distributed. These physical clues can show up years before blood tests detect a problem, and once you know what to look for, they become hard to ignore. One of the most telling signs is a skin condition that creates dark, thickened patches in specific areas. These patches most commonly appear on the back of the neck, in the armpits, around the groin, or in other skin folds. The skin takes on a velvety texture and looks darker than the surrounding areas, almost like a shadow or stain that does not wash off. This is called acanthosis nigricans, and it happens when high insulin levels stimulate certain skin cells to multiply faster than normal. The result is this distinct discoloration and texture change. Many people assume it is dirt or simply a change in pigmentation, but it is actually one of the clearest outward signs that insulin has been elevated for a significant period of time. Skin tags are another common physical marker. These are small, soft growths that hang off the skin by a thin stalk. They often cluster around the neck, underarms, eyelids, or other areas where skin rubs together. While skin tags can appear for various reasons, their presence in large numbers especially in someone who also has other signs of metabolic stress, can point toward insulin resistance. High insulin promotes cell growth in ways that encourage these little growths to form. They are harmless on their own, but they can serve as a visible clue that something deeper is happening in the metabolism. Changes in body composition are also significant. One of the hallmark physical signs of insulin resistance is fat accumulation around the abdomen. This is not just about overall weight gain, it is about where the fat goes. When insulin is chronically elevated, the body preferentially stores fat in the midsection. This type of fat, called visceral fat, wraps around internal organs and is metabolically active, meaning it releases hormones and inflammatory chemicals that make insulin resistance even worse. A person might maintain a relatively normal weight overall, but their waist size grows disproportionately. This apple-shaped body pattern is strongly associated with insulin issues and metabolic syndrome. Measuring waist circumference can actually be more revealing than stepping on a scale because it reflects the type of fat distribution linked to insulin resistance. Another physical sign that appears less commonly but is still important is fatty deposits around the eyelids or other areas of the body. These yellowish bumps, called xanthomas, can develop when fat metabolism is disrupted. While they are not exclusive to insulin resistance, their presence alongside other metabolic signs can complete a concerning picture. The key takeaway is that the body speaks through its surface. Skin changes, fat patterns, and unusual growths are not random. They reflect deeper processes, and learning to interpret them gives you a head start in understanding what is happening inside. Beyond what you can see, insulin resistance also changes how your body behaves throughout the day. These behavioral clues often emerge slowly and become part of your normal routine, which makes them easy to overlook. But when you step back and look at the patterns, they tell a clear story. One of the strongest behavioral signs is constant hunger, especially soon after eating. A person with insulin resistance might finish a full meal and feel satisfied for a short time, only to feel hungry again within an hour or two. This happens because the body's signals around hunger and fullness are disrupted. High insulin can interfere with leptin, the hormone that tells your brain you have had enough to eat. When leptin signaling is blunted, the brain does not register fullness properly, so hunger returns quickly, even though the body just received plenty of calories. Cravings are another major clue. People with insulin resistance often experience intense cravings for carbohydrates, especially sweets and starchy foods. Bread, pasta, cookies, candy, chips. These foods cause quick spikes in blood sugar, which trigger a surge of insulin. In the short term, this provides a temporary sense of satisfaction or energy, but soon after, blood sugar crashes and the cycle starts again. The body begins to crave the very foods that are making the problem worse. This creates a feedback loop that becomes difficult to break without understanding what is driving it. Energy crashes after meals are another common experience. Instead of feeling fueled and energized by food, a person feels sluggish, tired, or even drowsy within 30 minutes to an hour after eating. This is especially noticeable after meals high in refined carbs. The blood sugar spikes quickly, insulin rushes in to bring it down, and the sudden drop in glucose leaves the person feeling drained. This post-meal fatigue is often mistaken for laziness or just needing more sleep, but it is actually a metabolic response tied to how the body is handling glucose and insulin. Increased thirst and more frequent urination can also appear as insulin resistance progresses. When blood sugar starts to rise higher than the kidneys can manage, the body tries to flush out the excess through urine. This leads to more bathroom trips, particularly at night, and a persistent feeling of thirst as the body attempts to replace lost fluid. People often think they are just drinking more water because they are thirsty, not realizing that the thirst itself is a sign that something is off with their blood sugar regulation. These behavioral patterns, when they occur together or persist over time, form a recognizable signature of insulin resistance at work. Living with insulin resistance means dealing with constant shifts in how you feel throughout the day. Energy becomes unpredictable. 1 hour you might feel okay, and the next you are fighting to stay awake or focused. This roller coaster happens because blood sugar and insulin levels are swinging up and down rather than staying steady. After you eat, especially if the meal is heavy in carbs or sugar, your blood glucose climbs quickly. Your body responds by releasing a large amount of insulin to bring it back down. But because your cells are resistant, the insulin often overshoots, pulling too much sugar out of your bloodstream too fast. The result is a sudden crash. Fatigue, shakiness, irritability, and difficulty concentrating. These are not signs of weakness. They are direct consequences of unstable blood sugar control. Mental fog is another frustrating symptom. People describe it as feeling like they are thinking through a cloud. Concentration becomes harder, memory feels slower, simple tasks take more effort. This happens because your brain depends on a steady supply of glucose to function properly. When blood sugar is bouncing around, the brain does not get the consistent fuel it needs. Mood changes often follow. You might feel fine one moment, and suddenly irritable, anxious, or low the next. These emotional shifts are not random or purely psychological. They are tied to the metabolic instability happening inside your body. When your brain senses that the energy supply is unreliable, it affects how you feel emotionally. Sleep problems are also closely linked to insulin resistance. Many people with this condition struggle to fall asleep or stay asleep through the night. They might wake up feeling restless, thirsty, or with their mind racing. Blood sugar fluctuations during the night can trigger the release of stress hormones like cortisol and adrenaline, which make it hard to relax into deep, restorative sleep. Poor sleep then worsens insulin resistance the next day, creating a vicious cycle that makes everything hard. Over time, chronic sleep disruption compounds the metabolic problems and makes it even more difficult to regulate appetite, energy, and blood sugar. There are also smaller, everyday sensations that people rarely connect to insulin: feeling shaky or lightheaded between meals, getting headaches if you go too long without eating, needing caffeine or sugar just to feel normal. These are all signs that your body is struggling to maintain stable glucose levels. When you start to notice these patterns and see how they repeat day after day, the picture becomes clear. Your body is sending consistent signals that something in the energy regulation system is not working the way it should. Understanding why insulin resistance matters goes far beyond just knowing you have it. This condition sits at the root of many serious life-altering health problems that develop over time. When your body cannot respond to insulin properly, every system that depends on stable blood sugar begins to suffer. The pressure builds quietly, and if left unchecked, insulin resistance can evolve into conditions that significantly impact quality of life, longevity, and overall well-being. The most direct consequence is the development of type 2 diabetes. Insulin resistance is the stage that comes before diabetes. For years, your pancreas compensates by producing more and more insulin to keep blood sugar in check, but eventually it cannot keep up with the demand. The cells that produce insulin become exhausted and begin to fail. When that happens, blood sugar starts to climb into the diabetic range. This transition does not happen overnight. It is the result of years of stress on the metabolic system. Once diabetes develops, it brings its own set of complications, including nerve damage, kidney disease, vision problems, and increased risk of infections. Preventing this progression by addressing insulin resistance early is one of the most important things you can do for your long-term health. Cardiovascular disease is another major risk. High insulin levels contribute to inflammation throughout the body, particularly in the blood vessels. This inflammation damages the lining of arteries, making them stiff and prone to plaque buildup. Insulin resistance also disrupts your cholesterol profile, raising triglycerides and lowering HDL, the protective cholesterol that helps keep arteries clear. Blood pressure tends to rise as well because insulin affects how your kidneys handle salt and how your blood vessels respond to pressure. All of these changes together create a perfect storm for heart attacks, strokes, and other cardiovascular events. Many people who suffer from heart disease have underlying insulin resistance that was never identified or addressed. Weight gain, particularly around the midsection, is both a cause and a consequence of insulin resistance. High insulin locks your body into fat storage mode. That makes it extremely difficult to lose weight because insulin signals your cells to hold on to fat rather than burn it for energy. Even with diet and exercise, progress can feel frustratingly slow. The belly fat that accumulates is not just cosmetic. It is metabolically active tissue that releases inflammatory chemicals and hormones that make insulin resistance even worse. This creates a self-reinforcing cycle where the fat promotes more resistance, and the resistance promotes more fat storage. Hormonal imbalances are also common. In women, insulin resistance is strongly linked to polycystic ovary syndrome, a condition that affects fertility, menstrual cycles, and hormone levels. High insulin can increase the production of androgens, leading to symptoms like excess hair growth, acne, and irregular periods. In both men and women, Insulin resistance can disrupt the balance of sex hormones, affecting energy, mood, and reproductive health. The liver is impacted as well. Insulin resistance is a major driver of non-alcoholic fatty liver disease, where fat builds up in the liver, even without alcohol consumption. Over time, this can lead to liver inflammation, scarring, and reduced liver function. These are not distant abstract risks. They are real outcomes that develop when insulin resistance is ignored for too long. The good news is that this condition is often reversible, especially when caught early, but that requires recognizing the signs, understanding what they mean, and taking action before the damage becomes permanent. If you have recognized any of these signs in yourself, whether it is skin changes, cravings, fatigue, or weight around your middle, the next step is not to panic. It is to get informed and take action. Awareness is powerful, but it is only the beginning. The real value comes from using that awareness to make changes that support your body and restore its ability to respond to insulin properly. The first move is to talk to a healthcare professional, share what you have noticed, and ask for specific tests. A standard blood sugar test might not be enough. Request a fasting insulin test, a hemoglobin A1C test, or even a glucose tolerance test with insulin measurements. These tests give a much clearer picture of how your body is handling glucose and insulin over time. Many cases of insulin resistance are missed simply because the right tests were not ordered. Being proactive about testing can reveal what is happening beneath the surface and guide the next step. While waiting for test results or after receiving them, there are practical lifestyle changes that can make a real difference. Movement is one of the most effective tools you have. Physical activity, especially resistance training and activities that build muscle, helps your cells become more sensitive to insulin. You do not need to spend hours in the gym. Even short walks after meals, taking the stairs, or doing bodyweight exercises at home can have a measurable impact. The key is consistency. Moving your body regularly sends a signal that glucose is needed for energy, and over time, this helps reverse resistance. Nutrition plays a critical role as well. Reducing your intake of refined carbohydrates and added sugars takes pressure off your insulin system. Focus on whole foods that provide steady energy. Protein, healthy fats, and fiber-rich vegetables help stabilize blood sugar and reduce the dramatic spikes that drive insulin resistance. Eating balanced meals at regular intervals, rather than grazing all day or skipping meals, also helps regulate your metabolism. Small, sustainable changes are far more effective than drastic diets that cannot be maintained long-term. Sleep is another pillar of metabolic health that often gets overlooked. Poor sleep disrupts the hormones that regulate hunger, stress, and insulin sensitivity. Prioritizing consistent, quality sleep gives your body a chance to restore balance. Stress management is equally important. Chronic stress keeps cortisol elevated, which interferes with insulin signaling. Finding ways to reduce stress, whether through mindfulness, hobbies, social connection, or professional support, can have a surprisingly strong effect on metabolic health. These may seem like basic recommendations, but they work because they address the root causes of insulin resistance, rather than just masking symptoms. The important thing is not to wait until the problem gets worse. Insulin resistance is most reversible in its early stage. The longer it goes on, the more entrenched it becomes, and the harder it is to turn around. Every small action you take to support your metabolism moves you in the right direction, and those actions add up over time, creating a foundation for better health that extends far into the future. You have now learned how to recognize the hidden signs of insulin resistance, from the visible clues on your skin to the energy crashes that affect your day, from the behavioral patterns that seem unrelated to the serious health risks that can develop if these warnings are ignored. This information is not meant to create fear. It is meant to empower you. When you understand what your body is telling you, you gain the ability to respond early, make informed decisions, and protect your health before small problems turn into big ones. If any part of this video resonated with you, take a moment to reflect on your own patterns. Do you see yourself in these signs? Do they remind you of someone you know? Awareness is the first step toward change, and sometimes simply recognizing the pattern is enough to spark action. I encourage you to leave a comment below, sharing your thoughts or your own experiences. Your story could help someone else connect the dots in their own life. And if you found this information valuable, share this video with others who might benefit from it. Health knowledge is something that should be passed forward. Make sure to like this video and subscribe to the channel if you want more content
that helps you understand your body, spot early warnings, and take control of your health. We create videos that break down complex health topics into practical, easy to understand information that you can actually use. Thank you for watching, and I will see you in the next video, where we continue to explore the ways your body communicates and how you can listen more closely.